The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Today on Meet the Doctor, my guest is Brandyn Dunn. He's a facial plastic surgeon in Newport Beach, California. And you're the only one there, right, Dr. Dunn?
Exactly. No one else in sight.
I think that might be the most competitive part of California. What do you think?
I would like to say so. At least it feels like that sometimes. But, I think we're probably competing with Beverly Hills as well.
Yep. I would say that's fair.
Yeah.
So let's start by maybe just give us a little bit about yourself first.
Of course. So thank you so much for having me. I really appreciate it. This is a great avenue for us to kind of connect with our patients. So thank you.
You're welcome.
So my name's Brandyn Dunn, and I'm a facial plastics and reconstructive surgeon. I was born and raised actually in Hawaii and did my otolaryngology head and neck surgery training at the University of California, Irvine, which is kind of where I set my roots here in Orange County. And so met my now wife at the time. And so I did fellowship at the University of Kansas in the Midwest, a really busy, robust facial plastics program. Did many, many cases and then came back to Newport Beach to set up my roots. And I joined a practice doing the full gamut of facial plastics and reconstructive surgery.
And that's a pretty large group you're in, isn't it?
It is. Yeah. So we have two other facial plastic surgeons, an oculoplastic surgeon, and I believe 4 Mohs dermatologists. So it's a really nice place to kind of hang my shingle. And there's a lot of collaboration and a lot of opportunities to work with other physicians, bounce ideas off of people, and also get a lot of skin cancer reconstruction.
I think sometimes when people are researching and they land on a big group like that, it feels a little bit intimidating. Like if I call, how am I going to know which doctor is the right one for me? And so I'm curious how you handle that with all those doctors there and so many good choices for us to make.
Definitely. So yeah, I mean, the people I work with are incredible, so I can only speak very highly of them. But I will say the one thing that I bring to the table is kind of a newer, more advanced techniques in a lot of the surgeries that I most recently learned. And so I think that someone that can obviously relate with the patients, I've got a little bit more time to kind of spend with all of my patients and get to know them, hear their story, hear their concerns, and really connect with them. And then the other thing is like I said, I have all of the new techniques and tools to be able to kind of utilize them to be able to give my patients the best results.
So is it safe for me to assume that some people are referred to you from other places? They're being sent to you because they have skin cancer or they have an injury or something that requires reconstruction. If we divide them into 2 groups, what kinds of patients do you see that are referred to you? And then maybe tell us what kinds of cosmetic patients find you and what do they find you for?
Of course. So the ones that are referred to me are most often facial trauma and skin cancer reconstruction. So there are several dermatologists, obviously in our practice and also out in the community, that refer skin cancer patients. So, I really enjoy these types of patients because I get an opportunity to, if the timing goes really well, which oftentimes it does, at least at this practice, I get to meet them before the skin cancer is actually removed. So I get to talk about my planned reconstruction. I get to explain what the healing process looks like. I get to answer a lot of their questions and concerns and kind of give them an idea of what things are going to look like moving forward. So, and that's before they've had the surgery. It's a lot more difficult when they've had the skin cancer removed. They have this really large defect or hole somewhere, in a very vital situation. And then now we're kind of having to kind of clean everything up. So I find that really helpful. And those are a lot of the patients I see these days. And so that's one subset that's referred to me. And another one is also facial injuries. So any sort of nasal bone fractures on the sports teams, or, lacerations from a dog bite, or any kind of, injuries after a motor vehicle accident, cheekbone fractures or forehead fractures or eye fractures. I treat those as well. And so those are the ones that tend to be referred to me. And then there's the other subset of patients like you're talking about, which are the ones that kind of find me either online or from my social media or from my Google. Those are the ones that come, I'd say most often it's for cosmetic surgery. I'd say the most common is rhinoplasty. I do have my background in otolaryngology, head and neck surgery. And so all I did was do surgery in the face. And so I feel very comfortable with that. And I've been doing nasal surgery for many, many years now. And so I feel like that's kind of where they find me first. And then the slowly growing practice of aging face patients as well.
Mm-hmm. Do you do any non-surgical stuff?
I do. So I do Botox and filler, and we'll do skin resurfacing treatments like CO2 laser or V-beam for discoloration on the face. And also we'll do dermabrasion and microneedling.
I always like to explore the idea of having a facial plastic surgeon do your Botox and your filler, because I think people make mistakes in this area a lot. And luckily it's reversible, or it just doesn't take very long.
Definitely.
For that. If you make a mistake, it doesn't take a long time for it to go away. But would you maybe speak to the advantage of having a facial plastic surgeon look at you for Botox and do that versus maybe going to a shopping center?
Yeah. I see where you're going. So yeah, I think it's huge. And I don't think patients necessarily understand that, because I think Botox and filler is really becoming a commodity. And, you can go anywhere and get it. And I think most people generally do a pretty good job. And so as long as you do enough, most people do pretty well. I will say that, the advantages are the level of precision that I guess I have developed with time. Like I said, I've spent years and years dissecting and doing surgery in the face. And so understanding the different layers of the face and the complexity of the face and where the muscles sit and where the fat pads sit and where the bone is, and understanding those things are really difficult to learn in, a weekend course or some kind of training that, one of the filler or Botox companies or neuromodulator companies come and teach you in your office. And so I'd say that's one of the things. So understanding the complexity of the anatomy and really studying the patients and seeing how muscles move and seeing where you can kind of blend things and help with shadowing. And then the other thing is being able to deal with things if complications occur. And I think, if you've seen and you understand healing and you understand the potential risk, someone that knows how to manage these, has protocols in place to be able to manage these things effectively and quickly, and identifying them quickly and effectively, are really going to allow for the results to be that much better and safer.
Would you hypothetically just see somebody who went somewhere else and had a bad experience? Could they come to you and ask you for help?
Definitely. That happens often. Yeah.
I think it's hard to imagine getting a bad treatment and then going back to that person again to try to fix it. And I hope that we don't find ourselves in those places. But when we do, I always try to help people know what to do. Like, what is the best move if something does happen to you? And so here's another weird hypothetical.
Mm-hmm.
Let's say you have a 2-year-old who likes to headbutt, and one day they finally connect.
All this time they've been trying.
It happened to my sister.
Oh, no.
It was a famous Thanksgiving. Yes.
Of course.
And I've always sort of wondered, like, in the back of my mind, if my nose ever got broken, who would I even call?
Yeah.
And so you sort of need to, like, I guess if you're like me, you save things in your phone, like, rhinoplasty emergency.
Exactly.
Can people call you if they find themselves in the ER with an injury to their face or their nose?
Oh, definitely. And that's, I see nasal fractures quite a bit. And, oftentimes if you treat them early, you actually can save yourself from a surgery in the future. And the thing is really treating it early and getting in with the right people early and not delaying that. Not to give, medical advice, but you definitely want, in the first couple weeks, you really want to be seen by a specialist. And I would vouch for, anyone that does rhinoplasty surgery, whether it's a plastic surgeon or a facial plastic surgeon, but you definitely want to see a specialist. And if it's not treated early, then those individuals at least can be kind of set in a trajectory so that if you needed a procedure down the line, you can kind of have that scheduled and figured out.
How much time do you have really if you've been injured? You don't have to call like in the middle of the night.
Please don't. No, no, I'm just kidding. No. You can call in the middle of the night, but I'd say I like to see most of my patients 1 week after the injury. You either see it in the first couple hours, which is very uncommon to be able to get in contact with someone in the first couple hours, or within the first week, by the end of the first week. And the reason that is because it allows for enough time, the swelling to go down and for you to see what kind of deformity is actually there. So, occasionally when the swelling goes down, things look good and you don't need to do anything. But if you do need to do something, I generally like to do it within a 2 to 3 week window after the injury has occurred.
If you're in the ER, then is it best to just say, let's do nothing?
Unless a specialist has come and seen you, I would say yes.
Yeah, don't let the ER doc just bump it back.
I would, as tempting as it is, I would avoid that. Yeah.
It's not like relocating your shoulder.
No, it's
okay.
Yeah,
this is good
There's
advice.
a little bit more finesse than that. Yeah, than just pulling very hard.
Let's go back to skin cancer for a moment, and I want to hit on something that I think you could go a little deeper on there around the team. So, is skin cancer the kind of surgery where someone removes it and then you're in the same OR at the same time? You're there to reconstruct, or does it happen at two different times?
That's a good question. And that can be extremely confusing for patients coming in. So it depends on the office that's doing it. So skin cancer is removed typically by a dermatologist or a Mohs dermatologist, depending on the type of cancer. And so, like I said, we have 4 Mohs dermatologists in our practice. And so if someone comes in and they don't have a dermatologist or they're referred from a dermatologist, we can do it here. And so skin cancer, I'll give you the 2 scenarios. Or actually, it can be done in an outside office and they can have the skin cancer removed in the outside office and then they come to our office for the reconstruction. But typically, the skin cancer is removed under local anesthesia. So you're awake, they're just numbing up the area and they're removing the skin cancer. They sometimes have to do multiple stages depending on how advanced the cancer is. And then at that point, then your care is transitioned over to myself. And so when the care comes over to me, depending on the location and depending on the size of the defect, I do it either under local anesthesia as well, or I do it in an operating room setting where I have an anesthesiologist that can do twilight sedation. And so it's a gentle sedation, kind of like a colonoscopy or an endoscopy where you're just in a twilight sleep. And that allows for you to be comfortable and for me to have the time to be able to do the complex repair. So yeah, that's the general process. We like to do it in an ideal situation. It happens in one day in one sitting. But occasionally it will be a stage thing where someone will have it removed and then a couple days later we'll do the reconstruction. But ideally, we kind of get it in and get it out of the way for each patient so that they can move on with their lives.
Is there a good place to see photos of this kind of work?
Definitely. I like to highlight, my cosmetic surgery as well as my reconstructive surgery on my social media and on my website. So
I did notice this. Your Instagram is very educational.
Oh, thank you.
And there's a lot of explanation that you give in there that is unusual. And it stood out because I thought it was really helpful to the audience.
Thank you. Yeah, I try to spend time educating outside of the clinic and the consult experience too. So thank you.
I think it stands out when you can tell that someone enjoys teaching, and that's what it looked like to me.
Yeah, I do. I really do.
Well, let's go to aesthetics because that's really a much happier topic than skin cancer or getting smashed in the face by a 2-year-old.
Yeah.
How do you approach an aging face? And maybe one way to break it down, if you like this idea, is to kind of go by the decade. So I'm in my 20s, I'm in my 30s, I'm in my 40s, if that makes sense. Let's maybe approach it that way.
Yeah, of course. So I'll do younger, middle-aged, and then the older population. So yeah, I think that's a good idea. So for my younger patients, obviously for every single one of my patients, I do a full global assessment. I look at all of the components of their face and I see how things have changed. And I will say that the one thing about age is that, everyone asks, when is the time to have a facelift? And there's not really, it's really more on the physical exam findings that I see and that bothers you, that ultimately kind of makes me decide whether we want to have surgery or not. So, but let's start with kind of the younger patients. So the younger patients it's really about prevention at that point. And so Botox and fillers and skincare are really the big things that I talk about for a lot of those patients. And that helps to kind of allow for them to age more gracefully and kind of help them kind of delay a potential surgical procedure later, or at least make the results of a surgical procedure that much better later on in life. The other thing that I will say about younger patients that's kind of become a lot more popular, and I think the results are absolutely incredible, are getting a neckline that I think wasn't necessarily possible before. And that's because of a modern advancement in techniques. And so that's one of the things that I do and I really enjoy doing, because I think giving this confidence back to individuals that never really had a sharp etched neck and jawline is awesome. And I like to call it a deep neck lift. And sometimes you need a chin implant to kind of enhance that as well. But it really gives the chin and jawline as well as the neck such an incredible shape and contour. So that's the younger population.
Does that neck lift that you're doing have a name, or is it just?
I haven't come up with a name yet, but I'm in the market for that. But for me right now, it is a deep neck lift. It really is what I do. And so I basically get access to the deeper tissues. I contour them and remove if they need to be removed, or kind of shave them down or tighten them up. And then I allow the skin to lay over that. And that allows for kind of the redraping and that improvement in the neck contour and shape. And so then I'd say the next kind of stage is the individuals that start to have early signs of aging. And the most common signs of aging that I look for, and these are the individuals that ultimately are kind of leaning towards more of the surgical need. And this is jowling and neck laxity, platysmal banding, neck laxities, submental or fullness under the chin. Individuals that have these signs, if they're early, they can sometimes be camouflaged with filler or fat grafting, but early signs of aging tend to do well with filler and fat grafting, but a facelift or surgical procedures can really also make the results pretty incredible. So I will say that the facelift for these patients help to kind of reset the clock. It gives them a more refreshed look. It helps to address the jowling and the neck laxity, and it really addresses mostly the lower face. And so that's the lower face and neck lift. It helps to kind of enhance that area.
Maybe a bit of a side question, but are you starting to see more people who've lost a lot of weight in your area?
Yes, Ozempic.
Yeah.
Yeah.
I don't like to use a lot of buzzwords, but yes, I was talking about that effect. When you lose a lot of volume quickly, I don't know anyone who's unhappy about that happening, but it might make you look older than you do, sooner than you wanted it to.
Exactly. Yeah. I mean, bariatric surgery and medications now are causing weight to come off rapidly. And so, yeah, those are definitely things that we're seeing where it causes, individuals that wouldn't necessarily have these signs of aging as prominent, and it makes it a little bit more prominent. And so, yeah, those are patients that are coming in as well.
Have you started to think about how you might intervene earlier with somebody who's on that track of losing weight, so that maybe if you lost it all within a year, that you wouldn't end up looking 20 years old or a year from now?
Yeah.
What could you do between now and then if you know that you're on this path?
That's tough. One of the things that I will say is that a facelift, it holds up pretty well for a lot of things, but significant weight changes, it doesn't do as well. So I generally say, greater than 15 or 20 pound weight changes up or down, it really will test the facelift. And so, if you're in the middle, I'm not sure there's going to be, besides non-surgical options, I would say surgical is probably, it'd be better to wait to do surgery until you fully lost all of that weight. But non-surgical is such as like a thread lift or filler or fat grafting. Those can potentially be helpful to camouflage along the way as you're losing weight.
Thank you for saying thread lift. I think if you're of a certain age, you might already know that the thread lift has kind of a history of being controversial, at least in its early iterations. So I'm talking about 10, 15 years ago. And then it kind of fell out of favor, but for the last few years, it's been back and it's been very successful. Are you seeing people have really good results from threads now?
So I don't do threads, but I know a lot of med spas that I work with and talk to that are doing threads, and they do incredible things. I think the results are incredible. I'd say the biggest thing when it comes to a thread lift is just that the expectations are set, realizing that there's a limitation and the longevity is finite. But I think if you understand this, I think it's an incredibly strong tool that can be used to kind of camouflage and help with some of this early signs of aging.
How often do you see complications show up from threads?
I don't see a lot. And that could just be, I personally don't see a lot. They may just not be coming to me, but I personally haven't seen a lot.
Yeah. Well, an N of 1 is more than an N of 0?
Yeah, exactly.
Okay. Well, we've gone through your practice approach to patients. I think we have a really good sense of what you do on any given day. And it sounds really varied and interesting, and that you're helping a lot of people. I'm curious about you, especially away from the office. And I also am curious about growing up in Hawaii, because you said that at the very beginning.
Yeah.
So which island, and what do people usually ask you about growing up in Hawaii?
Yeah. I'd say that's, the most interesting quality when someone asks, what's the most interesting? It's like, from Hawaii. No, I loved it. I went to high school out there, medical school, and I got my master's out there. And so I spent a lot of time out there. And I grew up on Oahu. And the first question that everyone always asks is, do you surf? And the answer to that is not well, but I do. So I do what I can. And then being in Southern California, they asked me, do you still surf? And I was like, no, same. But for me, Hawaii was really my exposure to the outdoor life. So I'm extremely active. I like to go outside and hike. I like to be in the water. I enjoy just being out in nature. But my big thing is when I'm looking for exercise and I've got a short amount of time, I go on a run. But when I've got a long amount of time, I go for a hike. And so there's a lot of options here in at least Southern California. And so I've kind of explored a lot of those.
I had another Hawaii and I lost it. And so it was your training that took you away from Hawaii?
Yeah. So
eventually you had to go somewhere else.
Exactly. Yeah. After medical school in Hawaii, I moved to Southern California and came to University of California, Irvine for residency.
Wait, what medical school is in Hawaii?
It's called Johnny Burns School of Medicine.
That doesn't even sound real.
It doesn't. I mean, the other part about it is from the classroom where we did, the first 2 years of our lectures, you could see Diamond Head, Waikiki, and the ocean. And it was, it didn't feel real a lot of times. You kind of have to pinch yourself.
It probably didn't feel like you should be in a classroom. Like, what am I doing in here when I could be out there?
Exactly.
But on the other hand, I could see how it would make you like really sure that this is what you want to do. Because if you could be outside instead, yeah. Yeah, I like that.
One of the things about Hawaii that I do want to mention that I thought was kind of neat, what brought me to this career, was I had a mentor in Hawaii who was a facial plastic surgeon. He was previously at Cleveland Clinic and then moved out to Hawaii. He was actually involved in one of the first face transplants in the US. And so that was pretty incredible. And so he was an unbelievable mentor. And the thing that got me interested in facial plastics was there was a case, that skin cancer reconstruction case, and he asked myself, a medical student, a resident, and he had a fellow at the time, how would we reconstruct this? He gave us the basic principles of reconstructive surgery, and he said, come up with something based on these basic principles. And it really, that idea of solving problems and realizing that three people with three different experiences, three different exposures can come up with different, although reasonable ways of reconstructing something is what facial plastic surgery is. And I think, the beauty of reconstructive surgery and even aesthetic surgery is like, it's your surgeon and myself has a way of approaching this and can develop a plan based on our exposure and experience and our understanding of anatomy and come up with a beautiful and reasonable answer. And so it was that experience that really kind of led me to this field, which was kind of unique. So yeah, I wanted to share that.
What's your favorite place to get away and go outside in Newport Beach or in the area that you live now?
Corona del Mar, which is a small city just south of Newport Beach. Actually, I think it's technically within Newport Beach, but
I think it is.
There's a spot over there that has a view of the sunset in the water that just kind of takes me to my special place. Yeah.
Have you ever lived anywhere cold?
Kansas. And,
just Kansas.
And that was enough. 1 year.
Yeah, I'm sure. You're pretty landlocked there.
Yeah.
Yeah.
Yeah, I realized I needed to be by the ocean. Definitely.
If we're listening today and we want to find out more about you, where should we look?
You can find me online. You can find me on my website at brandyndunnmd.com or at the practice that I'm at, which is Appearance Center of Newport Beach. You can also find me on Google and also on Instagram, Facebook, or TikTok at Dr. Brandyn Dunn.
And your name is spelled a little bit different, so
it is.
We should point out that.
It's Brandyn, Brandyn. Last name is Dunn, Dunn.
Thank you for sharing yourself with us today, Dr. Dunn. It's been a privilege getting to know you.
Thank you for the opportunity.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, THEAXIS.io.